Dr.Jou's Natural Medicine Clinic. I'm a natural medicine doctor working in South Korea, and I have been working in this field more than 35 years. I try to patients with many difficult diseases, and tinnitus is one of the symptoms that most people have come to us with. Tinnitus, or ringing in the sound in the ears, may be one of the most tough and difficult disease because it is very difficult to control the symptom, and many people have to through a lot of difficulties when they do everyday activities because of the ringing sound that continuously keep buzzing, whizzing, or else noises. The ringing sounds usually very frustrating and very annoying, that it is very difficult to endure the difficulty, difficult to control the symptom in short. So now let me talk how to approach the problem, how to resolve the problem, because there are so many people suffering from the disease. Let me make one point clear. When we take a look at the anatomical structures of the ears, we can see when we take a look at the anatomical structures of the ear, it is very difficult to find out any type of pathology around the ear area. So it turns out that the anatomical problems does not exist in almost all the patients with tinnitus. So we have to find out another problem. When we take a look at the pathways in which the sound signals is transferred to our brain, there are many processes in which the signals is transferring, and the most important one is that the hearing nerves or auditory nerves play a major role in transferring the sound signals to our brains. So our brains receives the signals that is transferred by the hearing nerves, and then we interpret it as we usually do in our own ways. However, when there is a problem with the hearing nerves, there may be some amplification of the sounds. This means that some noises may take place as a result of the underactivity of the hearing nerves. So we hear some sounds ringing around our ear, even though there is no sound outside of the ears. What is causing the disease and how the tinnitus take place as a result of the underactivity of the hearing nerves. So we need to solve the problem by normalizing the functions of the hearing nerves, and this is exactly what we do to take care of the patients with tinnitus. Now, we need to restore the normal functions of the hearing nerves. It is very essential and the core and the essence of our plan to make the patients feel better. It's clear the real culprits for the problem of tinnitus is not the anatomical structures around the ears. The real culprits for the disease is the hearing nerves or auditory nerves, and we need to restore the normal functions of the hearing nerves. And this is the basic and the fundamental plan we are going to approach the problem. Now let me explain what causes the underactivities of the hearing nerves, and this will help us remove the fundamental symptoms or fundamental pathologies of the disease. Now, we don't use any microscope in order to find out any type of pathology associated with the problem, but we use some abdominal diagnostic imaging and hair mineral test in order to find out the pathology that is causing the disease. Now let me explain. As I said, one of my patients who have the problem of tinnitus feel much better as he worked with us for about 2 months. Well, this is really surprising for the patients to feel better within the period of 2 months, because the tinnitus is such a very difficult and very tough problem to control. Now let me explain how we help our patients feel better. Now this is the image around our ear structure, and this is the ear canal, and this is the auditory nerve or hearing nerve. As you see, from the perspective of the medical knowledge, we can see that there is no problem associated with these anatomies of the ear structure. So we can see that auditory nerve or hearing nerve is the main culprit. So the problem is how to restore the normal functions of the hearing nerves is the most important things that we have to do. In order for the normalization of the hearing nerves, we have to diagnose some of the factors that is causing the disease. Now this is the diagnostic abdominal image, which we often use in working with our patients. Through this image, we can understand what type of pathologies are involved in the development of the symptoms, and we can see this is the body image or torso or trunk image. This means that this is the navel and this is the torso of our patients. By analyzing the images, we can approach the fundamental pathology of the disease. Now we can see that there is some tenderness around the liver area. What do you think this means? Well, this means that there is a toxicity over the liver area, or the liver is working very hard in order to remove or detoxify the heavy metals or other toxins from our bodies. So this means that the over toxicity or existence of the toxicities of various type of toxins is really existent in the patient's body, and the liver is working very hard for the removal of these toxins. From the perspective of the natural medicine, many types of toxins can damage the functions of the hearing nerves, and this is the essence for the pathology of the disease. Now let me point out another screening test or a diagnostic test, and this is the hair mineral test. Well, this is the image that comes from the hair mineral test. We can see that this bar indicates the normal values of these minerals, and this is the allowances of the values of the norm of the various type of minerals. However, we can see that the iron and manganese is now at a very high level, more than you can expect, more than we can imagine. Iron and manganese is at a very, very high level. So this means that the existence of these heavy metals, for these heavy metals have the function of damaging the auditory nerves or other nerves as well. So we need to remove these toxins from our bodies, and then the liver may be very comfortable with the removal of the toxins. By this program, we have been able to make our patients feel much, much better, and the patients can get into sleep very well without the feeling of frustrating noises around his ear. So he feels really satisfactory with the outcomes that he can from my clinical practice. For the removal of iron toxicity, we need to understand that there are some nutritional supplements that contains the iron, so we need to avoid them. Also, there are other supplementary nutrition that contains the manganese, and we need to avoid them. This is the basic information we need to know. And another thing that is also very much important is that in the air there are some fine dust or smokes that contains the iron or manganese. So we need to protect ourselves from the attack of the manganese and iron in the air. And this encouraged us to put on the filtering masks in the big cities such as Seoul. So if you live in the very smog area in the larger cities, then it is necessary for you to put on the filtering masks in order to protect yourself. And this is also the basic information. And the way we work with our patients with tinnitus is to detoxify the patients of heavy metals and toxicities of iron and manganese in this way. And also there are some nutritional supplements that we use to detoxify the heavy metals and to encourage the detoxifying pathways of the patients to work much better way. And that is exactly what we're going to do with our patients and have done with our patients to this day. The patients have felt much better as he worked with us for about 2 months, and this is a really surprising result because the tinnitus is such a difficult symptom. I'm sure that in my clinical practice we have seen a good number of tinnitus patients, and we have helped them greatly, even though they did not get better results from any other clinics or hospitals whatsoever. So we are sure that we are able to offer a really wonderful and beautiful protocols for our clients with tinnitus. And thank you for sharing and listening to my clinical practices. Thank you very much.